Hi, Ben.
Hello.
Okay, so today we're going to do an abdominal exam. Ben is our volunteer, and we're going to start just by inspecting the abdomen as he lies down relaxed. He's breathing. I'm checking the abdomen when he's supine and relaxed and breathing, looking at it for symmetry, surface motion, which is normal. The abdomen to the eye looks symmetric. Skin characteristics are normal. Venous patterns look normal. I'm going to ask you just to raise your head if you can. Raise your head as though you're doing a crunch if you can. Okay. And so what I'm doing is observing his abdomen. You can relax now. It doesn't feel as though there's a separation of the abdominal muscles or any kind of a hernia. There were no noticeable masses or bulges, neither when he was supine nor when he sat up. So I didn't notice any abnormal movement, no abnormal pulsations, or any kind of noticeable peristaltic movement right now. So the next thing we're going to do is just auscultate the 4 quadrants of the abdomen. We're going to be listening for bowel sounds. What I want to hear are tinkling sounds, and normally we'll hear about 5 to 30 per minute. So we're going to start in the upper left quadrant, the upper right quadrant, the lower right quadrant, and the lower left quadrant. And what we have here are active bowel sounds in all 4 quadrants. So that's how we auscultate the abdomen. So we're going to continue with auscultation by listening to the arteries. We'll start with the aorta. So we're going to go just to the left of the midline here and listen to see if we hear a bruit, which we don't. And then the iliac arteries on the left and the right. And we would inspect the femoral arteries as well here on the left and on the right as well. And we don't notice any kind of bruit. So the next thing that I'm going to do is I'm going to percuss your abdomen, which means I'm just going to make a tapping motion on your tummy in kind of, if we were to divide your abdomen into 4 quadrants, I'm going to make tapping motions in all 4 quadrants. I want you to let me know if you have any pain or have any tenderness. Okay, thanks. Okay. You didn't feel anything?
No.
Okay. And the sound that we have is a tympanic sound over his abdomen, which is normal. So we don't really notice any areas that are dull or unusual. So the next thing that we're going to do now is actually try to assess the liver and estimate the liver size. And the way that I'm going to do that, starting at the midclavicular line around the umbilicus, is that I'm going to percuss starting here and upward until I notice a dull sound. Just a moment. And then I'm going to mark that area. And then, starting superiorly, kind of in between the ribs above, I'm going to do it again, descending. I'm going to mark that area. And then we're going to measure between those 2. And we find that the distance is about 6 centimeters, which is normal. After that, I'm going to actually just try to palpate the liver edge, which is a little bit trickier. And I can do that by starting at the lower area that I marked. I'm going to place my fingers. I'm going to ask you to take a deep breath. Let it go. And again, let it go. Sorry, we'll try it one more time. Again. Let it go. Okay, one more time. Let it go. Again. Let it go. Okay. I couldn't feel it that way, the liver edge. I'm going to try just by placing my fingers here at the costal margin, straight down and in a bit. I'm going to ask you to take a breath. Let it go. I can't really find the edge of the liver. So another way I can do my liver assessment is by using the ulnar side of one hand to strike here, and then on the other side, and ask you, do you feel any pain or discomfort?
No.
Okay. Okay. Next thing I'm going to do is just palpation on the abdomen. We're going to start with a little bit of light palpation on your abdomen. You're going to let me know if there are any areas that feel tender or painful. Does this hurt?
No.
Good. Okay. Okay. While we're at it, we're going to check the umbilicus, which looks normal, and the umbilical ring. Nothing seems unusual. And then we're going to do deep palpation. You're going to feel more pressure right now. Tell me again if you feel any kind of pain or discomfort. Any discomfort or pain?
No.
Okay, good. All right. Next, we're going to check for gallbladder tenderness. I'm going to place my fingers here and have you breathe in deep. Breathe in deep. Let go. Did you feel any unusual tenderness in that spot where I had my fingers?
Not at all.
Not at all. Okay, good. We're also going to try over on the left side to feel for his spleen in the same way. That can be really tricky. And breathe in and out. And the spleen is not palpable. Okay. I could try to, on a patient who's very slender, I could try to palpate the kidneys by placing my left hand underneath the flank and my right hand under the costal margin, and having the patient take a deep breath. Take a deep breath in. Actually, a deep breath in if you can. Take a deep breath in. Okay, and hold it. And then slowly release your breath. Thank you. I'm going to try to capture the kidney between my two hands, which can be really difficult to do in a person who's not extremely slender. And I'm not able to palpate the kidneys this way on our patient. So what I will do actually is just have you sit up. I can help you to sit up. I'm going to have you turn your back to the camera, actually. Good. And sit up with your legs this way. Okay. And then what we're going to do is just percuss the costal vertebral angle for kidney tenderness. I'm going to get up behind you. You're going to let me know if you feel any pain on the left and on the right sides. Painful?
No.
Painful?
No.
Okay, good. And that concludes the abdominal exam. Thank you.